Thank you, Professor Julio. Good morning from Brazil to all of you, and also for my crewmates. I'm Davi Souza, and I'm participating of mission 62 of Habitat Marte. And today I'll be talking more about the health center, how would be the operation of a health center in a Mars habitat. So these are the topics that I will be covering during this presentation. Just to really quick, I will be covering some topics about the design of the infrastructure, also the technologies, the management, and also protocols and spin-offs. Some initial considerations about human health in space. We have many images from NASA talking more about the hazards about the space flight. And as you can see here, we are dealing with a hostile environment, even not only during the space flight, the human space flight, but also when we arrive in the future in the Mars surface. We need to deal with some issues related to health because we are dealing with humans, and then the environment, if the environment changes, the human body will respond to these changes. So also some hazards that the humans will be facing during the space exploration. We have the altered gravity, the radiation, the isolation, closed environment, the distance from Earth, also medical occupational medicine. Also, we can, as I mentioned, the interaction with the environment, and also some risks related to the bone and the muscle loss related to the radiation exposure, and also it can even cause some cancer and this stuff. So it's good to know that all of this research related to the risks and the mitigations, how these risks could be mitigated, the NASA and other space agencies are already researching it in International Space Station, the ISS. So we can have many information about it and how would be, in this case, we can imagine how would be the health issue in a future habitat on Mars. These are also other considerations made by NASA. As I mentioned, the altered gravity related to the physiological changes. As you can see, the space radiation, also the distance from Earth and hostile and closed environment, and the isolation and confinement. And I will be covering some topics also related to the behavioral aspect of isolation and how are the mitigations for this issue too, for this hazard. And this is just to present you what are the topics that the space medicine can cover. And just to tell you, I'm not a medical specialist. I'm not from the medicine area. I'm an engineering student, but we need to have the minimal knowledge related to health because we are humans. We need to know how is our body working, if we are healthy, and we need to know the minimal. We need to have the minimal knowledge, and even for future mission to Mars, the astronauts need to have this minimal knowledge, and they need to be capable to conduct a self-assessment to their body and their health. So medical approaches are related to crew training, the physiological support, physiological measures, and many others, as you can see, radio protection. And these are some results, some results based on life science studies. Now, considering the internal design of the health center, we are considering a proposed master plan by Yash Hattu, in mission 47th. And so, as you can see, the health center is located near of the main station in the greenhouse. This is, we can imagine how would be the logistic approach related to this location, because we need to consider that the main station will have the amount of astronauts, and in case of any emergency or any if it's necessary to the astronauts conduct any checkup or anything else, it would be more easier and more fast to arrive in the health center. And also related to the greenhouse, we can imagine the production of medicines with crops and plants, considering the phytotherapics and the development of natural medicines with biomanufacturing. Just to present you also the proposal of Yash Hatod, just to show you the location of the health center. And for the internal design, I'm proposing integration of 3 circular structures, as you saw before, with 8 meters of diameter. And we would have a main structure with 3 floors and the other 2 complementary structures with 2 floors. I will be covering more about how would be the division of these structures. The internal areas, I'm considering a three-age area, just to separate the astronauts that will be arriving in the health center, and so it will be easier to manage the astronauts inside of the infrastructure. Also, an emergency area, considering the clinical and surgical procedures. As an area more related to the physical and mental well-being, and also laboratories. And I'm considering the idea of a wet laboratory and also a dry laboratory. So we will have this difference from each other, and I'll be presenting with more details during the presentation too. And the basic needs, for the basic needs of the astronauts, the dormitories with beds, a small kitchen with dining room, also a toilet, and a food maker production vertical module. And for the division of the health center, as I mentioned, I'm considering 3 infrastructures connected. And so in the main infrastructure, we would have the 3-age area, because this would be the area that would be connected with the main station and the greenhouse, and so we would have more circulation of astronauts inside of this area, and will be more easier to manage this circulation. Also, the laboratories and the dormitories too. In one side, we will have the Zen area, specifically more related to as I mentioned, more related to the physical and physiological well-being, and also our emergency area. For the main area, I'm dividing these 3 floors. Like in the ground floor, as I mentioned, we would have the circulation area and also a 3-age area. This area will be composed with X-ray rooms, considering radiology, radiotherapy, and also radiodiagnosis. In the first floor, we would have the laboratories for molecular biology. That would be the wet laboratory, and also the bioinformatics laboratories. That would be the dry laboratory, and also a 3D printing room to conduct research, and if it's necessary, any kind of tools or equipments, this area will be providing it. And in the second floor, it will be the dormitories, the kitchen, the toilets. This area will be more like a social area for the astronauts, for the basic needs like entertainment and relaxation area. For the emergency area, I'm considering like the ground floor, we would have a surgical procedures room, and also central sterile services to make the cleanings of the equipment and the tools after the surgeries and after the surgeries and before the surgeries if it's necessary. And also ICU area for intensive care unity, considering like the isolation and hospitalization of critical patients. And for the Zen area, we would have like considering the mental well-being associated for food production, we would have the food microproduction module, and also our rooms for physical checkups and behavioral therapies. And in the other, in the first floor of the Zen area, we would have like rooms for individual and group integrative practices that will be covering this topic also during the presentation. So technologies to be applied in the health center, as I mentioned, the area for the room for 3D printers, also basic tools and utensils like pipettes, glass jars, PPE, and other equipments, microscope for the laboratories, weighing balance, also a biochemical analyzer with also associated with wearables, security cabin, a small greenhouse for the infectation to avoid contaminations and this stuff, the equipment, this distiller, also a laminar flow hood and a biological safety cabin. And as you can see in the picture, just to present you the AstroSkin technology, which is like a spacesuit, a kind of spacesuit, a wearable for the astronauts that it was implemented in the ISS, and it was developed by Canadian Space Agency, and it's a wear suit that the astronauts that make possible the monitoring of these parameters like blood pressure, also skin temperature, breathing rate, and blood oxygen and others. And other parameters that are really important to monitor the health of the astronauts. And related to it, I'm bringing here a proposal of Professor Julio that was presented in last meeting, related to the dashboard. To control the entire station, we will have a specific area of the dashboard associated to health. And as I mentioned, this would be like a system that will be capable to provide a status about mental condition, heart rate, calorie consumption, level of physical activities, blood pressure, urine, feces, and also examinations, and also provide reports and alerts if it's necessary. Some resource to be generated in situ or transported from Earth. I'm considering the medicines and the phytotherapics. Some medicines will be necessary, and also some raw materials will be necessary to be transported from Earth, like bacteria, fungi, and plants. But also, when the astronauts will be arriving on Mars, they will be capable to cultivate these living organisms to provide medicines and these stuff. And the 3D printers will be useful to develop the personal protective equipment, the PPEs, and also other equipments necessary for surgeries and other medical activities, and also research, and also to provide some medical devices. And just to have an idea of some technologies related to 3D printing of organs and bones, I saw just it was already transplanted a ear, 3D printed ear And so they are also developing such other organs to be useful for transplant, and this research are still under development. And also some surgical tools. Related to the management aspect of the health center, I will be considering the general aspects that we would have in a structure to provide telemedicine equipment in case of, if we are considering the isolation case of our mission that we are facing a possible threat of a virus. So if the astronauts are isolated in each infrastructure, it will be necessary to provide like a telemedicine, the specialists in medicine will be inside of the health center, and then they will be providing some support for the other astronauts in the other facilities. Also robotic mechanisms and for assistance, and 3D printing. Also, this structure will have system for continuous monitoring of rooms and equipments, because if we are dealing with some vital systems for like in case of a surgery, it's really necessary to have the status of these equipments and for the whole room too. The laboratories will be designed for cutting edge research and provide innovations aimed at surgical performance, equipment manufacturing, and also testing of new medicines. It will be also responsible, the laboratories will be responsible for developing disease models, response systems to physiological stress, nutrition, and cellular behavior. And just as I mentioned before, we would have a division of both laboratories. The red one would be for molecular biology and would be responsible to develop and provide tools for the development of research projects in the field of molecular genetics, and provide logistical and operational support for conducting gene expression studies. And also, if we are talking about some topics related to plant production, the GMO, like the genetic modifier organisms, this will be a collaboration research and a collaboration work with the greenhouse too, that can be useful for the whole habitat. And the dry laboratory would be associated to bioinformatics, will be a research area to promote the use of computational techniques and tools to solve some biological problems, and also collect, organizing, and interpreting some data, some collected data. And also some areas to characterize these areas that I've mentioned before. The triage area would be intended for fast clinical evaluation of the patients, and as also to carry out tests, check vital signs, and also conduct some radiographies, and to detect cases that meet the criteria for hospitalization or refer to another level of care. So it would be more like a people management area to separate and also to tell to an astronaut, hey, you go now to a surgery area, to a preparatory area for the surgery. You will go to a checkup room, these things. The intensive care unit, the ICU, would be a critical area intended for the admission of critically ill patients and who require intensive care by a specialized team in case of a post-operative period, or like during a quarantine or something like this. A Central of Sterilized Services, the CSS, would be an area intended for cleaning, conditioning, sterilization, and distribution of all hospital medical tools. And a physical and behavioral checkup room, as you can see in this picture, some technologies developed by NASA to monitor like the body of the astronauts during an exercise and this stuff. And so if this kind of technology, this kind of checkup room is useful for us here on Earth, you can imagine how it would be this on a Mars habitat. Related to the positions, profiles, and duties, I'm considering here four main positions. Would be the clinical doctor, and these astronauts would be the head of the infrastructure. Will be responsible for the surgeries, to supervise the protocols, monitor remote calls, and also to monitor the online dashboard. And the radiologist nurse will be responsible for triage and managing the flow of patients, and check the radiation levels and monitor the checkups and accompany the surgeries. Will be more like an assistant of the clinical doctor. The biotechnologists would be the astronauts responsible for the laboratories, also to produce and test the medicines, and also develop some phototherapies. Would be also an astronaut with a minimal knowledge or necessary knowledge in IT, and capable to handle the 3D printers, and would be also responsible to study the virus, the bacteria and other contaminants that may appear in the habitat. And also, I'm considering here a specialist in human well-being would be like an astronaut which have an amount of knowledge related to nutritional aspects, to monitor the astronauts' nutritional levels, related to behavioral, like a nutritive behavior, and also how these things can affect in mental well-being and also in the body of the astronauts. Also will be responsible for conducting collective leisure activity and promote physiological well-being of the astronauts, and monitoring the biomechanics and the physical analysis. For the astronaut training program, so all of this that I'm proposing here, the most part of this not the technical stuff, but like the minimal, considering the minimal knowledge necessary for like a first aid or any emergency situation, it's necessary to provide the astronauts a minimum knowledge for any intervention, like for an intervention by a non-medical crew. As I mentioned in the beginning of the presentation, I'm not a specialist in the medical area, but like we need to have this minimum knowledge to provide any kind of, like, if it's necessary, a fast emergency, a first instance emergency. We need to provide any kind of help, any kind of support for the crewmate, the crewmate, and or maybe for other that will be there on the habitat. And considering this, would be necessary to have some courses of first instance emergency, like the first aid, and handling some analysis kits. Also providing a basic understanding in biosafety, and cataloging and understanding of medicines and how they act in our bodies. And I bring here also considering the well-being aspect. I bring here in my presentation, and also it was a research made by me and Professor Julio, and I did this presentation during the Space Habitat event about this research called the Resiliency Building in Space, providing and enhancing the astronauts' well-being based on Habitat Marte experiences. So in this research, we have some experiences in Habitat Marte missions, presidential missions, which it was possible to divide this a possible training in resilience in the research area, the work areas, the social areas, and also individual areas. And as you can see here, I won't be covering all of these topics, but just to have an idea related to the routines, not only in the research, but also in work areas and social areas. Provide also entertainment and interaction with the other crew members, a mutual social support, exercise creativity, promote a good and healthy sleep, and these other topics that are really it's really necessary when we are considering a resilience approach for space. Some videos, as you can see here, I bring 4 videos. The first one is related to the 3D printing of organs. And also the second and the third one are more related to the first aid training. And the first one is really quick video, it's more like an introductory video, but the second one is a complete training with 1 hour video that shows us many with details, the procedures, and how would be the measurements that need to be taken. And as I mentioned, it's necessary to have the minimum knowledge about the medicines that will be consuming, the food, and how does the things that we take affects in our body, in our brain. And this video shows how what we eat affects in our brain. So these are some necessary basic knowledge that we need to have, that the astronauts will need to have in a future space habitat. And resource necessary for 1 week, considering the crew capacity of 4 astronauts, related to the food, the diet and the amount of food to be consumed by each astronaut will be specific to each individual, and it will be also determined by the weight, the height, the biotype, and the routine of the astronauts. And also, with that, I'm considering an amount of 2.1 kilograms of a daily consumption by person. And so during 1 week, for all the astronauts, will be an amount of almost 60 kilograms of food. And related to the water, considering 3 liters of water by person. And I always like to mention that these are some terrestrial patterns. So we are considering a case of Mars, how would be these 3 liters are for us here on Earth, but maybe on Mars will be different. And also it's really interesting to mention that also when we are dealing with health, the health that we are talking here are more related to the health based on what we already know about health here on Earth. So on Mars, the health aspect, the health approach can be different, can be switched. Some parameters can be switched and can be diverse. So considering these 3 liters of water, this would be a weekly consumption of an amount of 84 liters of water. And some guidelines should be provided to the other facilities. And as I mentioned before, the line monitoring and the service dashboard would be necessary to collect data on behalf of the crew, and would be responsible to restore and select information about the wearables and the checkups, and which will be performed by the astronauts themselves. So the astronaut that will be responsible to provide guidelines to the other crew members will be responsible to to compare the data from the wearables and the checkups and also the exams to have an idea how is to have a general idea how is the health of the astronauts. And this data would be imported into the system. The selected data will be imported into the system. And also provide some recipes and follow-up for simple treatment procedures, like to have an option to make some video calls with the astronauts, and also as I mentioned, the intervention by a non-medical crew, like in case of isolation, the dashboard will be supporting in these follow-ups too. Associated to the protocols, the first one are the specific protocols on the health center facility. Will be the basic protocols related to checkups, radiological analysis, also the constant cleaning of the entire structure, cares with the body, physiological reports, and checking the validity of the medicines. Just to, as you can see in this picture, like a cleaning activity in a laminar flow hood, and related to the cleaning of a laminar flow hood, and also some checkups related to blood pressure. And some protocols, these specific protocols, it's called SALT triage. It's associated for sort, assess, life-saving maneuvers, and treat. And just as you can see, we have like a division of each patient based on his conditions. And we will have some diagrams, some fluxograms that need to be followed to have an idea how is the category that the patient would be into. So just to have an idea, as you can see, like some questions like is the patient is breathing, or does he have any injuries, or like so he's have any possibility to not survive. So these are some questions, some basic questions that need to be done, and also some activities that need to be conducted to have the answers for these questions. Related to protocols of safety, the use of the PPEs like the mask, gloves, and cap during surgery, anti-radiation safety cabin, as you can see in the left picture. And related to the use of the PPEs, we are, during this pandemic time, we are dealing a lot of it. The PPEs are more usual for us in our daily lives, but for the medical staff, we have some divisions of these PPEs, as you can see, like to enter into a risk area with no patient, with 1 meter distance of the patient, in a high risk area, and also some aerosol generating procedure. So we have 4 different types of the use of the PPEs in different situations, just to have an idea. And so the protocols will be more like related to evaluate the conditions of the environment, the area, and to provide the necessary PPEs to go inside of the specific area or specific room. And also to cleaning the space and the equipments when we are dealing with safety and health. And the medicine approach, it's really necessary to have a really cleaned space in areas. Some protocols for occupancy and entertainment. And considering occupational health practices, it's also called the integrative health. Just to have an idea, in this picture, the integrative health are like the middle point when we are dealing with complementary health and alternative medicines, self-care, and conventional medicine. So, we are dealing with the 3 main aspects that can contribute to our health, not only the conventional medicine and also the alternative medicine, but also the self-care the astronauts, and like the integrative practice are in the middle of these three stages, and also some leisure activities in order to promote the collective and individual well-being. Also, I'm considering here the rotation of positions according to demand of each sector or area of the infrastructure. Also enable some moments of rest after exhausting workloads, and just to mention like some surgical procedures and like during like if there is a lot of quantity, a lot of astronauts to do the triage, and after this time when finished the triage, it's necessary to have like a time, higher time to have a rest of the astronauts during these exhausting workloads. And I'll be complementing in other slides the integrative and functional medicine nutrition therapy, which is also an approach, an interesting approach related to nutrition and how does it affect in our body, and also how does it integrate with the environment and this stuff. Protocols for food microproduction. This is the basic guidelines for the protocol that I bring here. It was a result of research conducted in Habitat Marte, and also it was presented in a paper during the IAC, the International Astronautical Congress, in this year during the cyber event. And just to have an idea, we have the routines associated to management, maintenance, recycling practices, harvesting and processing, and also develop activities like analysis, diagnosis, ensure the circularity of the system, assure the fidelity of the methodologies, orientations, and detect some possible failures. And associated to these protocols, we will be considering the food logistic, the cleaning and the contamination routines, reports, storage, status monitoring, and also some the management of the wastes that are produced. Protocol for 3D printing. The idea of that are some possibilities that could be 3D printed, the materials and tools for surgery and the laboratory, the production of PPEs as we already hear, as we already have here on Earth during the pandemic. It begins really common. Also the organ printing, just to present you this picture, the procedures, the stages to 3D print any organ or any specific organ. We will have the cells and all the equipments, and some materials like the hydrogel, and there are other necessary materials considering the application. We would have the bio-ink, the plastic, the fabrics, and also, as you can see in this picture, the hydrogel to produce some organs. Associated to the spin-offs, some technology that could be applied here on Earth. We will, as I mentioned before, the study of organ production is quite research that is in development. The effects of radiation on the human body and the plants. Conduct studies on physiology of the physiological aspect of isolation. And also I bring here in this picture, as you can see, the reagent suite, which is a medical support system for monitoring astronauts' health, and which has been used in rehabilitation practices. Just to present you some important use of the space technology in our daily lives. So in other guidelines, as I mentioned, the IFMNT related to the nutritional therapy. So these are some guidelines related to nutrition to do like a personalized nutrition care related to assessments, diagnosis, intervention, monitoring, evaluations. So we have these 5 aspects related to, as you can see, related to the biomakers, the metabolism of the astronauts, the systems, the food lifestyle and environment, and the nutrition and physical signs and symptoms. So this is all integrated and can provide us good solutions for the health to be providing to be assisting in the health in our health here on Earth, and also some directions for social isolations, guidance on exercise, and the guidelines on nutrition, and provide safety in the health in regions with limited access to medical facilities. Like we can consider the 3D printers if in a specific region which does not have any medical facility, it would be easier. Like they have a raw manufacturing material that will be providing, that will be developing a medicine, specific medicine, and also I can mention here the remote, the telemedicine that will be also assisting some people in some extreme regions. And related to the impacts to the sustainable development goals, I bring here the 4 main goals that can be correlated with the topics that I covered here in this presentation. And I can be mentioning the SDG 3 associated to the good health, which is related to the improvement in access to quality basic health care, in addition to several guidelines and practices aimed at collective well-being. The SDG 4 will be associated to the more qualified medical teams with education focused on the handling of new generation technological equipment. Associated to the SDG 9 would have structured healthcare units, including high-tech machinery and equipments with new branches in pharmaceutical industry with low cost and improvement in the quality of the medicines. And also, this would be providing public-private partnerships, the PPPs, in favor of a more sustainable and accessible evolution in the area of health and medicine. So these are my references, and thank you very much for your attention. For those who will be watching this presentation later on YouTube, I'm open also to questions. You can contact me, and now I'm open to questions for my crewmates. Thank you very much.